discussing the importance of communicating effectively with your healthcare providers and the steps you can take to make sure you're getting the right care. Deb Bernacki joining us now with that information. Good morning.
Good morning. How you doing, Alexis?
I'm doing well. How about yourself?
I'm great. Thank you.
So why is it so important to make sure that, how does this play into the level of care people receive in terms of how well they communicate with the doctor?
Well, as you become older, there are more problems that you may be experiencing. So this makes it difficult sometimes to communicate with your doctor, but it's even more so something that you need to focus on because you may have more health problems as we age. So being prepared for your doctor's appointments and doing things that will enhance communication during your appointment is what we need to focus on.
This applies to anyone. If you're going to the doctor, you want to make sure that you are paying attention and you are engaged in discussion so you can find out about, better options for you. But particularly older adults we're focusing on now, what is the best way? What do they need to make sure they do when they are having those visits to make sure they are in tune with their healthcare needs?
Well, both for your in-person visits, if you're doing virtual visits, or even just speaking over the phone or communicating via your computer, you need to prepare for those appointments. So writing down a list of what you'd like to discuss if you have problems that are current, and also since you last saw your healthcare provider, if you've fallen, if you're experiencing new problems, make sure you bring that list with you and review that list with the doctor. Bringing a list written down of your current medications that you're taking, because they always compare it to what they have in their computer. So you want to confirm their list, but also if maybe you're missing a medication that you just let fall off somehow. So making sure you bring your list of medications and review those with your healthcare provider. And then also, so often as we age, we have problems with our hearing, problems with low vision. So making sure you have your hearing aids on and make sure you bring your glasses, wear glasses. And if you're having a problem or understanding your doctor, tell him or her, I need you to speak slower. I have problems hearing. So just be open with your communication and talk to them about it. Sitting face to face with the doctor is an important thing too.
Yeah.
And another thing that's really important when you go to see your doctor is stick to the point. Just stick to the point. Oftentimes, we get lost in telling a story, and there's limited time with your healthcare provider. So making sure that you use specifics, talk about what you're experiencing, and the doctor will ask you for maybe precipitating factors, alleviating factors to get the whole picture. But telling a big story, it can cause problems sometimes.
And I know another thing that my mom often talks about when she gets time to go see my Nana, going to the doctor's appointment with a loved one, helping to advocate for that person.
Yes, definitely taking someone with you. If you can bring a loved one, that's great. At Happier at Home, we have caregivers and case managers that could go with you. But having an extra set of ears, because anyone could experience this. The doctor's talking, you're focusing on something else he or she just said. And that person can help to be an extra set of ears or even write things down for you to remember for when you leave and you can discuss. But having someone with you is a really great idea.
Yeah, some really good points here. Where can people go for more information? There's a lot out there, and maybe just more of these reminders are online.
Right. Online, there's so much information. If you'd like to review the information that I discussed with you today, you can go to our website at happieratHome.com. Always can take a look at what we have as far as blogs and our previous appearances here.
All right. Very well then. Deb, thanks so much.